This video is talking about Gellhorn type pessaries, either a long stem or a short stem pessary. The removal and insertion is essentially the same. The objectives of this video are to review how to remove, clean, and reinsert a Gellhorn pessary, and to understand the potential complications that can occur with this type of pessary and how to prevent them or manage them. So with any new type of procedure, the technique of dealing with pessaries, removing them and reinserting them, is something you master over time, and every patient's pessary is slightly different. Keeping the patient comfortable is one of the most important things that you want to ensure before, during, and after the pessary change. Verbally preparing the patient and explaining what you're going to be doing so the patient knows in advance and during the process what to expect and what is happening. Working slowly and carefully and observing the patient for any signs of discomfort is important. Making sure that you lubricate the introducing portion of the pessary with water-soluble lubricant so that it slides in easily is another tip. The Gellhorn style pessary is used primarily with uterine prolapses or with a grade 3 type cystocele prolapse. It works quite well for women who have very wide introituses where a ring or a donut pessary will not stay in the vagina. The stem of the Gellhorn pessary is what sits in the vagina. The base of it is up at the top of the vaginal vault, and the stem keeps this from moving to flip, to fall out. It comes in two different lengths. It will depend on the length of the woman's vagina whether a long stem or a short stem would be used. When you open the vagina, the labia of the vagina, you should be able to see the stem of the pessary as is shown in this picture. Some stems are higher up in the vagina, and you may need to insert your finger into the vagina to find the stem and locate it. To remove the long stem Gellhorn pessary, it is easier to use a curved locking forceps, which were provided for you with this package, that you can either insert into the stem of the pessary through the hole, one arm in the hole, the other on the outside, and when you have it inserted as far as you can comfortably, you lock the forceps, which then provides you with an ability to use your non-dominant hand to pull the pessary towards you. This gives you the option then of putting your finger farther into the vagina and finding the base of the pessary, and ensure that you can move the pessary and flip it back towards you so that you can easily pull the pessary out. This can be a bit tricky, as sometimes there is suction behind the base of the pessary that you need to break, and sometimes a small lip has formed around the base of the pessary, which you then have to ensure that you loosen that little lip so that you can easily get the pessary out. It's very important that this pessary be removed with enough timing so that you're not pulling it and causing any tearing that might occur. So cleaning this particular type of pessary needs to be a bit more rigorous than regular pessaries. Because there is a tendency for debris to get clogged in the stem of the pessary and also into the holes of the pessary, you need some type of little bristle brush or a good pipe cleaner to be able to ensure that when you're washing with soapy water that you can ensure that each of these holes is cleaned out and that there's nothing left residual wise in them. Once you have scrubbed it thoroughly, then make sure you rinse it really well with water. It isn't unusual for these pessaries to become somewhat discolored over time, and they can in fact absorb a bit of odor, but unless they turn color and really become malodorous such that you wish to have it replaced, they usually last about a year, 2 years in terms of changing. To insert the Gellhorn pessary, you want to ensure that you have the stem bent so that it is flat to the base of the pessary, as shown in this picture. You want to ensure that you've lubricated the end of the pessary that's going to be inserted first so that it will go in smoothly. When inserting this pessary, you want to ensure you have a good hold on it so that it won't slip, and you want to ensure that you can insert it towards the base of the vagina and push it through the introitus at that point where there tends to be more of a give. You may even want to angle it slightly on a bit of an angle to ensure pushing it through towards the back wall of the vagina and sliding it slowly into the vagina so that it goes up. Once it's into the vagina, you need to use your finger to push the base of it right up to the top of the vagina as far as it will comfortably go and ensure that it's in good position. This takes a couple of minutes to do it carefully so that the patient is not too uncomfortable while the process is being completed. Most vaginal pessaries are relatively simple to manage, and we don't get a lot of complications with them. But I did want to take a few minutes to talk about some of the things that can occur and give you some sense of how to manage them. Pessaries in general are changed every 2 to 4 months, depending on the individual patient. So vaginal discharge, bleeding if it's related to erosions or ulcerations, and bowel dysfunction are the most common complications that we see. So vaginal discharge is probably the most common thing we see, and a lot of it depends on whether or not the patient is using some vaginal cream, such as Premarin, for support of the vaginal tissue. It is a pretty normal response to having a pessary in place, and the vaginal discharge should usually be a creamy yellow, greenish in color. It can also be a bit thick and creamy in texture. I do notice that it tends to occur more towards the date when the pessary is due to be changed, and it may be that you just need to increase the frequency of the changing of the vaginal pessary. So for example, women who choose to have their pessaries changed every 3 to 4 months and are complaining of this kind of discharge, I might be tempted to move them up to 2 to 3 months to see if that has an impact on the discharge. I would only consider swabbing the discharge in case there was any type of vaginal infection, if there was a foul odor to it, or if the patient had any redness and irritation that was visible, or if they were describing any type of itch. Quite commonly, what I would do is take the pessary out and leave it out for a few days and give them a break from it, let the discharge clear up, and then reinsert the pessary, and usually there's no further issues with it. It can also be related to the use of their vaginal estrogen or Vagifem, which they may be using. And if you may want to reduce or increase the amount that they're using depending on the amount of discharge. I also find that moisturizing gels such as Replens or Gynotrof are helpful in reducing discharge. So vaginal bleeding can be a sign of some type of an erosion or ulceration that has occurred as a result of the pessary rubbing on the vaginal tissue. So we want to be careful to pay attention to any complaints that the patient may have of spotting or bleeding. It should be noted, however, that I also found that when patients are straining with the bowel movement, which we're going to talk about next, they may experience a small amount of spotting at that point in time because of the straining, and that is not necessarily something you need to get concerned about. However, when you remove the pessary, you're going to take a moment to run your finger around the inside of the vaginal tissue and do a sweep to see if you can identify any bleeding that is evident. You will have noticed on the pessary when you removed it whether there was any evidence of bleeding on the pessary. And if there is evidence of bleeding, then you want to feel and see if you can feel any type of an erosion that you think may be present. It would be at this point that you may want to insert a small speculum to have a look to see if anything's going on. If in fact you do identify an erosion, then the pessary should remain out for a couple of weeks. And you may want to ensure that the patient is using some Premarin vaginal cream or Vagifem on a regular basis to help with the healing process. If there is no sign of an erosion, then it may be that the pessary has become too large and it would need to be resized, in which case, if you're able to provide a resizing within your own practice, that would be an option. Otherwise, a referral to a gynecologist may be necessary to ensure that the correct size of pessary is being utilized. Bowel dysfunction is another issue that we need to consider, primarily that of constipation. The pessary, depending on the type and style, does increase the pressure in the rectum and can contribute to the patient having to strain with a bowel movement. We don't want the patient to be straining with a bowel movement, primarily because there's the potential for the pessary to come out of the vagina and would then need to be reinserted. We need to encourage the patients to ensure that they're drinking enough fluids and consuming enough fiber in their daily diet, and if they're not, to encourage them to increase that. Make sure that you ask them about their bowels and if they're moving regularly, and if they're constipated, so that you can prevent that from occurring. One other strategy that can be effective if they have issues with constipation and do have to strain with a bowel movement, that is to ensure that they put their finger in front of the vagina to hold the pessary back in the vagina while they're having a bowel movement, and that can be effective as well. Follow-up pessary care really depends on each individual patient, but usually every 2 to 3 months. It depends when you remove the pessary what condition the vaginal tissue is in. So if it's irritated, you may want to do it more often. If they're using a vaginal moisturizer and it's easy to remove the pessary and reinsert it, then probably you have the right amount of time that you're currently following. When the pessary becomes difficult or tight to remove, then often increasing it to a more frequent changes will help with that. One thing is very important to remember is that pessaries cannot be ignored, forgotten, or left in place. I encourage you to book the next pessary appointment before the patient leaves the office so that they have that in place, and to keep track of when they are due to come in. In conclusion, I hope this short video has been helpful to you, and that you're able to watch it as many times as needed to feel confident with doing your pessary care. You will also find that enclosed with the connection for this video was an information health sheet for each of your individualized patients that provides you with written instructions, primarily the same as what I've talked about in this video.